You're watching It's All Connected, Functional Medicine Edition by Dr. Gaul on Resonance Wellness TV, part of our Whole Life Medicine Alleviate Series. Keep in the loop about future webinars and events on whole-life-medicine.com. Good evening and welcome to our monthly webinar series for our patient community and hopefully a little bit beyond. Tonight's webinar is about functional medicine, and today we're going to be talking about the functional medicine approach and what it brings to your health investigation when you consult Resonance Wellness. I am so glad that you're joining me here today, and it's really great that you're taking your health seriously and you're actively working towards educating yourself about ways to better yourself and make improvements where necessary. I really appreciate your participation. A lot of you are coming back to multiple webinars, and I appreciate that you're taking the time to educate yourself. Our goal for today's event is to explain a little bit more about functional medicine, how it fits into naturopathic medicine, how it might differ from conventional medicine, and to review how it's incorporated into our whole life medicine model at Resonance Wellness, and how it can play a role in your overall health. So just to begin, I want you to take a moment and think about the definition of health. Would you consider yourself to be healthy? And how do you know you're healthy? And I'm going to ask you to hold that question in your mind as we start here. So our lecture on functional medicine will focus on points from the perspective of Alleviate, from the whole life medicine model. And that's our first step in health strategy at Resonance Wellness. Our Alleviate is the first step in my approach to patient guidance. And so when we talk about functional medicine, we're really talking about the starting points of Alleviate in the whole life medicine model, of which there are 4 major zones. In short, there's 3 considerations when we're looking at strategies to resolve a health issue and Alleviate. The first is to consider what the root causes are in our health situation and really ask ourselves, what's the setup? So diet is chief lifestyle intervention in any natural health plan for both prevention and treatment of disease. And functional medicine not just includes diet, but includes a number of different things across the board. The second to look is looking at the state of the tissues involved. And in a clean slate process, we're looking at how to improve the cleaning up of the tissues that get bogged down in a disease process. In functional medicine, it's thought that detoxification can be a crucial aspect of improving your health across the board. And lastly, missing ingredients. So how do you get the ingredients for metabolic function and repair in your body? And so, the quality of nature of what you eat plays a huge role, but we can also use, other strategies, including supplements for that, and do something very specific functionally for a particular organ system. And so with those all in mind, you can see there's also problem-specific programs for particular chronic conditions. And in functional medicine, there's some standardized kind of approaches to how you might support somebody with a particular disease state. So whether or not you have a skin condition or diabetes or a heart condition, there are some basic functional approaches to those things. So with those thoughts in mind, we're just going to dive right in here. So I'm going to come back here to my original question. And as we looked at the root cause and the detox and missing ingredients part of Alleviate, did you think about where in those key areas you might be healthy or unhealthy? When you're defining health, it might seem simple, but what it means to have health has really changed definition-wise over the years. And when we're asked to define health, some refer to the way a person looks or acts, but others can take into account somebody's state of well-being as well. In the past, health was really defined as somebody free from disease or illness. And that would make sense, when a leading cause of disease could be infectious disease caused by bacteria or viruses. But as time has gone on and socioeconomic conditions have improved, and also medical advances have unraveled the mysteries of contagious disease, and there's been the invention, obviously, of very powerful medications, it's really led to the eradication of a lot of the infectious diseases overall. And health today is really closely linked to how we live, as the leading causes of death are now related to lifestyle factors. And that distinction has led to wellness as being the primary factor of health. Wellness can really be defined as a positive, whole health approach, and it includes physical, social, intellectual, and emotional well-being. And this distinction becomes crucial as we delve into the difference between, say, conventional and functional medicine. When it comes to determining the status of your health, four big factors have been identified for consideration, and they include personal health behaviors, physical environment, the influence of heredity, and the quality of health services that are available to you. So in health behavior, our health habits contribute to at least 50% of all major causes of death. Lifestyle dramatically impacts the quality of health. Behaviors identified by researchers include sleeping habits, dietary habits, physical activity, how much you weigh, and the use of tobacco and alcohol. Just as a beginner, most of us are familiar with those things as being big factors in health risk. The second thing is your physical environment. So the environment includes the places that you live and where you work, and also to a degree where you play. And the conditions of each environment directly impact your health, from air quality to noise level, access to fresh food choices, crowded living spaces. The physical environment plays a significant role in your health outcome. Third is heredity, and genetics definitely influence certain disease factors which are passed down from generation to generation. And while heredity certainly plays a role in certain diseases, in many cases, behavior and lifestyle choices can reduce or increase the risk of such disease by modifying genetic expressions. Last but not least is health services. And this aspect really refers to access to care. That includes the ability to reach a healthcare facility as well as financial access to healthcare. Of course, in Canada, we have a public healthcare system, and it's not as marked as where people might have a lack of health insurance. But certainly in the more supportive aspects, functional medicine is not really found in our public healthcare system to any major extent. And so most people who are looking to incorporate lifestyle factors are also looking at paying for that advice or paying extra for things that might actually support a functional medicine point of view. Now, when you look at disease, non-communicable diseases, so those that are not transmitted by infection, like I said, are the leading cause of death globally, with a notable exception of Africa. So while currently deaths in Africa are mainly attributed to infectious and viral conditions, the World Health Organization predicts that non-communicable diseases will already be the biggest killers in Africa by the year 2030. So things are changing, and they have changed across the world in most locations to model more of a Western lifestyle approach. Of course, there probably are some much more isolated places that don't have as strong of a link. But at this point, we're living in a global culture, and you're starting to slowly but surely see the influence of that. The main factors for chronic diseases include smoking, physical inactivity, high levels of alcohol consumption, and obesity. And although tobacco remains the leading cause of chronic conditions, the sedentary lifestyle is really not that far behind. The main types of non-communicable diseases include cardiovascular diseases, just like stroke, heart attack, diabetes, certain forms of cancer, and chronic respiratory diseases. And these are all heavily linked to lifestyle choices. Lifestyle-related diseases often have a long latency period. That means that it makes them really difficult to detect until a condition is often in a more advanced stage. The good news is, of course, that non-communicable diseases are very preventable through better lifestyle choices. So now that we're maybe all on the same page regarding the definition of health, we can explain functional medicine a bit better. So in many ways, functional medicine is similar to conventional medicine, and it's similar to naturopathic medicine. They're both practiced by licensed medical professionals. All are evidence-based, employ diagnostic tests, and to an extent might even use prescription medications within that context. So where the styles of medicine differ is in guiding philosophy. So conventional medicine is really well equipped to correlate symptoms with an illness, and that's ideal for addressing acute or urgent medical conditions such as infectious disease or broken bones or physical trauma. However, we just shared the leading causes of death are chronic conditions that develop over a long period of time. And this is where functional and naturopathic medicine come into play. So while conventional medicine is focused on the symptoms and the treatment with the goal of turning the symptoms off, naturopathic and functional medicine address illness by identifying and addressing underlying causes. So basically, functional medicine is health-oriented, where conventional is more disease-oriented. Functional is patient-centered, where conventional is doctor-centered. Functional is more holistic. Conventional is more specialized. Functional focuses on prevention, and conventional focuses on disease detection. So, of course, as you already all know, I'm trained as a naturopathic physician, and I've had many questions about whether or not I know about functional medicine. I used to laugh quite a bit when I got this question, which confused people. But the short answer is yes, of course. A lot of the basis of naturopathic medicine is seen in functional medicine. And while technically naturopathic medicine and functional medicine are not identical, much of the understanding is the same. And I've had the good fortune to know and learn from many of the individuals who were key in the development of functional medicine. And it might interest you to know that functional medicine in some ways was actually originally spearheaded by naturopathic doctors, and it was a way of actually making the basics of lifestyle medicine available to non-NDs. So to share it with the MDs and the DOs and the other allied health professions that were coming more from a conventional system approach. And this has actually gained a lot of traction, definitely in North America, and it's certainly starting to spread into Western Europe and across the world, where an approach that includes lifestyle factors is being made more accessible. Now, this doesn't necessarily include all the components that we see in naturopathic medicine, and it certainly doesn't include all the components that we're going to see in whole life medicine model, but it's a very good new traction step where there's some very brave, conventional, medically trained souls who are kind of venturing into functional medicine and finding a great deal of success with it, which of course we already knew with naturopathic medicine, and you guys probably already knew. But like I said, it's a name for a system that comes really, really close to what we're doing in Alleviate. So it's important to note too that functional medicine is not rejecting conventional medicine, but it's using it as a foundation on which to add new dimensions in the evaluation, management, and prevention of chronic disease. So functional medicine offers a more personalized and integrative approach to healthcare. And the process involves prevention, management, and understanding of the root cause of complex chronic disease. Because of the dramatic shift from infectious to non-communicable disease, functional medicine and its related lifestyle intervention is really needed to address chronic lifestyle-related illness. And with functional medicine, healing the patient replaces treating the patient. So what are the pillars of functional medicine? The foundation of functional medicine is based on three main pillars. One is really patient-centered care. So this is where we're practicing caring for patients and their families in ways that are more meaningful and valuable to the individual patient. It's historically, and I don't know how much of the time you guys get to see medical research, probably not that often, but let me reassure you that medical research is done from the perspective, not really of functional and preventative strategies, but for looking for key parameters that can be measured. And of course, that is very, very important. We need to be able to measure what we're doing and what's happening as a result of an intervention. But unfortunately, medical research really suffers from that same desire, because we can't always measure the things that are actually the most important, or we can't actually often measure what all of the factors are that are changing when we're actually using a lifestyle intervention approach. And this actually makes it difficult to do short-term studies about functional medicine. We can do long-term studies about functional and naturopathic approaches, obviously, where we actually follow people over a much longer period of time and see whether or not they develop disease or how that goes. But a lot of the short-term studies, it's much harder to show positive effects of functional medicine over very brief windows with very limited numbers of patients. So really, it's more patient-centered as a result, and that really involves creating a client-doctor partnership for creating an individualized care plan. The second pillar is ideally having an integrative and science-based methodology. And, we're trying to utilize the latest evidence in medical research and clinical expertise. There's a pretty complex web of genetics and medical history, basic physiology and lifestyle. And if we can combine those, we really get an inside-out approach to identify any physiological imbalances. We also try to integrate the best medical practices from multiple disciplines. And so functional medicine is combining traditional Western medical practices, especially in the diagnostic category, with other types of therapeutic approaches from around the world. And so the integration of multiple disciplines emphasizes prevention of disease through nutrition, exercise, and lifestyle, and the use of the latest types of laboratory testing and diagnostic techniques, and access to combinations of medications, botanicals, supplements, therapeutic diets, exercise plans, rehabilitation plans, detox programs, and stress management techniques. Now, if you are not familiar with some of the things that we're using diagnostically in these models, what you can actually do is take a look at our whole-life-medicine.com site. That's our resource site where we're trying to now put as much as we can, information as we can on the things that we are attempting to incorporate in everybody's plans. We don't always have the chance to do that because it really depends on the individual nature of the person's complaint. But I always appreciate it when people have had the chance to take a look at what sort of laboratory testing and stuff that we have available. And if you take a look at whole-life-medicine.com, you should be able to see those things under the lab tab. I'm just sorry, I'm typing and speaking at the same time. There, I just put it up on the chat box for you. If you haven't seen that, that's our resource site. Now, the most important element of functional medicine approach is the prevention of disease, like I've said. And as the adage goes, an ounce of prevention is really worth a pound of cure. So the goal is to help the body function optimally with the intent to support self-healing. And rebalancing the body once a disease has progressed is more involved and may require medical intervention, which is why prevention is preferred. So the tools utilized by functional medicine reach far beyond pharmaceuticals and surgery. Detox programs and stress management techniques is something that we're often using and tailoring to what an individual patient needs. And this way, we create a partnership between me and you, and it lets you become an active participant in the healing process and really allows a patient to be in control of improving their health and achieving their own optimal wellness. So when we look at systemic disease, because I've used that term, systemic disease is a term that's used to describe conditions that affect the entire body rather than a single organ or body part, as opposed to an infection that might only affect one body part or an organ, where something is called localized. So many diseases can be considered systemic, and some common systemic illnesses that people are familiar with include arthritis, cancer, chronic fatigue, diabetes mellitus, high cholesterol, hypertension, and lupus and the other autoimmune diseases. That's just some examples. And what's really important when we're looking at systemic diseases is trying to identify root causes. And there can be any number of factors causing an illness, combining to cause an illness. There's a few common root causes, and these are the things that I'm evaluating when I take somebody's history or we're taking a look at people's labs. One, of course, is inflammation. You can have improper sleep habits, a poor diet, way too much stress, immune imbalances, trauma, both physical and mental. Negative thought patterns can cause a lot of underlying stress and immune dysfunction. A lack of regular exercise, really poor digestion or known digestive problems, and toxin exposures. These are just a handful. And there's obviously a lot of common concerns that have a functional approach, things like allergies or depression or obesity or irritable bowel syndrome, anxiety, fibromyalgia, chronic pain. When people suffer from the common health concerns like those, different people will have a different combination often of root cause factors. There might be some ones in common that lots of people with that particular condition would have, but not everybody is the same. And so it's a question of figuring out what is the most stressed in this person so that when we are evaluating, we really have a better sense. So when you come into our office, you can expect obviously to spend a lot more time with me than you might with a conventional provider. And you can also expect to do most of the talking. A functional practitioner or somebody who uses functional medicine is trained to listen to patients and gather a really detailed personal and family history and the circumstances around the first symptoms and lifestyle habits and health behaviors. So many of you have been subject to the 16-page health form and other questionnaires and things that we use to gather information. And the reason for such a detailed account of your health is to really help to uncover underlying causes of your health problems and determine what kinds of examinations or testing might be best suited for individual needs. And you might also have had the experience with me of telling me lots of different symptoms and me being able to say, okay, well, these three are related. And these three are related. And so we're not treating 6 things, we're treating 2 or 3 things. And that's actually kind of the unique perspective of functional and naturopathic medicine, is that we can figure out what's related so that when we make an intervention, we're not aiming, 6 cannons in 6 different directions. Because most people assume that every chief complaint is something separate. But in reality, for most people, it's not. And that is really the main difference functionally versus conventionally. So we can discuss lots of topics as a result of that, right? We can discuss simple lifestyle changes. We could test for things like hormone imbalances or for proper diet for that particular person. We can be assessing family medical history and using that history as a means of prevention by examining things that could potentially happen with risk factor assessments or particular lab tests. We can strengthen your body's normal healing abilities by supporting a tissue instead of just narrowly attacking the symptom or the disease process. We can eat whole foods instead of unhealthy processed foods. I'm hoping you guys have seen the Whole Life or the Whole Foods webinar that we talked about just a few months ago. That might also help you to figure out a couple things on your own. So when we're addressing specific conditions, we're really tapping into a number of core body systems. The first, like we were said before, is optimized nutrition. So the right balance and quality of macronutrients, which are things like protein, fats, and carbs, and micronutrients, which are vitamins and minerals, can really kickstart a body's natural healing process. And some of those are basic things. A diet high in sugar, unhealthy fat, and processed food can really cause the immune system to be really dysregulated. When you have a diet that's rich in natural antioxidants and phytonutrients and all those colorful pigments and plant foods, that can really support your well-being in a way that, some of the processed stuff really can't. And through natural functional medicine, you can really work with us to create a diet that really works for your lifestyle and provides your body with fuel and protection. Now, the other core body system is hormones. And this can really be addressed with this approach as well. And imbalances in hormones occur for any number of reasons. Okay, they can be medication side effects. You can get that from diabetes, from stress, from thyroid disorders, and even more. And hormonal balances occur in both women and men, and they're responsible for a lot of adverse health conditions. Symptoms hormonally can really range, depending on the glands involved. Sometimes the symptoms are very mild and you don't recognize that they're hormonal, and sometimes they're very severe and they're very obviously hormonal. But depending on the kind of hormone balance in question, you can use a number of tests to confirm imbalance. We can use things like urinary Dutch testing. I don't know if any of you on this call have had this kind of test, but that's actually a urinary metabolite test that gives us a very broad overview of everything that has happened to you hormonally across the board. So reproductive hormones, stress hormones, you can see in how balanced they are, what their relative amounts are like. And it's a kind of testing that's really superseded the saliva hormone testing that we used to do. Even the saliva hormone testing we used to do is far superior to the blood testing we've historically done for hormones, because hormones don't really float in blood. You don't get a really great sense of relative hormone balance there. But we are developing new functional tests all the time that are really honing in with much more information than I've ever had before. Now, you can also obviously use normal blood tests with looking at it from a functional perspective. We can use more specialty tests. We can also use, imaging. Imaging can be really important in hormonal imbalance, especially when you're looking at thyroids. As an example, we often will have to work with your family physician, though, to get a hold of some of those things. Now, the next major imbalance is inflammation. Lots of people are worried about inflammation nowadays, and I've seen people attempting to do things that they know are anti-inflammatory, or they've been told are anti-inflammatory, whether it's an anti-inflammatory diet or an anti-inflammatory supplement. And inflammation through a body often accompanies a chronic disease. And inflammation is actually a normal process. You want the ability to inflame something. It has a vital role in protecting the body from foreign invaders and abnormal cells. But an overactive inflammatory response obviously can contribute to illness. And so when we're looking at inflammation, one of the biggest impacts that you're going to have on inflammation is your overall dietary balance. I know it sounds like a bit like a broken record, but doing metabolic typing gives you a lot of information about what diet actually would control your kind of inflammatory symptoms the best. Not everybody produces inflammation in the same way. We have common pathways to inflammation, but how things trigger and interact with the individual can be different. So functional medicine really addresses inflammation by correcting those kind of nutrient or dietary deficiencies, and also to a degree hormone imbalances. Now, the next major underpinning is gut health. And so issues in the digestive system is something that we take very seriously, because the digestion, absorption, and assimilation of all those foods and nutrients we eat is critical for health. And a breakdown anywhere in that process can really create illness. Sometimes it's not very obvious, like it doesn't happen in the first couple of weeks that it starts, but it builds slowly over time, because all of the digestive processes are interdependent on one another. They're sequential. And sometimes you just have an error in function in one of those things for lots of different reasons. And when one step goes down, a lot of them can go down. And so over time, what we've seen is a lot more difficulties with digestive problems, because we also have a tendency in Western culture to intervene the most in digestive processes. For an example, the biggest number of prescriptions in medicine are for acid blockers. And even the most common over-the-counter medications are acid blockers. And the problem with that is that acid is required for digestion, and your stomach actually needs to have acid for digestion, and it needs to have acid for digestion not just for the beginning process, but also to trigger the sequential processes from there. So what that can do, if you break that down, is create big problems in, the sterility of the upper gut. So now we are seeing a lot more people who have overgrowth conditions in their guts. They have had big changes in their flora, creating big problems. Antibiotic use also substantially contributes to these sorts of conditions. We can also have people who are eating things that really just don't agree with them and create a lot of inflammatory immune activity in the gut. And that can create what people have termed leaky gut syndrome. It's not the most elegant term, but in essence, what that's telling you is there's inflammatory damage to the inside of the gut that's interfering with its barrier function. So when we have a chance to normalize digestive processes, clean up the impact of those kind of well-intentioned interventions, sometimes for the gut or sometimes for other conditions, and then balance things out diet-wise and function-wise, many symptoms can be lessened or dissipate altogether. Now, another big pillar that's considered in functional medicine is detoxification. We've done some work on detoxification in the Start Here, Start Now series, and probably closer to January, we will be doing some detoxification discussions. So keep watch for that. I think we haven't posted the next set of lectures we're going to do yet for after October, but we're going to do that shortly. So you can keep on the list for the things that are going to come up in a timely fashion. And the body is really, from a detox perspective, it's really designed to eliminate toxins. But, we have a lot of exposures to things that are new and novel. For one thing, highly processed diets are new and novel to the biology. And so are the chemicals that we're exposed to, in packaging, in air quality, in furnishings, in including mattresses, in paints and other coatings that we use inside our home, in plasticizers, that come in contact with so many of our vital tissues. We have toxins in our water, some intentionally stuck in the water for various reasons. So we actually have a lot more exposure to things that our body has to handle. And really, it's amazing. The body can actually handle a lot of those kinds of things of its own volition. There's a couple of things that, like I said, are not really natural. And so there's confusion in the body about how to eliminate them. And so really what we want to do is address the issue with toxic burden. So, like decrease your actual exposure to toxic things. Decrease the amount of pesticides and herbicides that you're eating or using in your home environment. Change the kinds of cleaners you have under your sink. Eat foods that are more natural in origin, that are not highly processed. Use body products that don't contain tons of volatile plastic or petrochemical compounds. These have big impacts on health long term. Again, you don't notice it in a week, but you'll notice it over the long term. So there's lots of things that we can do functionally to improve detoxification that have to do with supplying the cofactors for the normal detoxification processes. And of course, we can, like I was saying before, we can just clean things up. And sometimes it's just as easy as making sure that somebody's drinking a lot of water. As many of you know, I'm kind of a little bit of a water intake beater upper. And it's crucial to so many processes, including detoxification processes. The liver is very watery, and many of the processes that we use to detoxify occur in solution. So the more water that we have, or the most appropriate levels of water for you, will improve your detoxification ability pretty dramatically. Now, another component of functional medicine is also considered to be stress reduction. And that's has a direct impact on your physical well-being, in the sense that your mind and your thinking processes are directly connected to your physical body. And so reducing stress is an essential aspect of disease prevention. And any number of stress reduction techniques can really be utilized depending on what fits into your lifestyle. You might have noticed that last month we did a webinar on meditation practices, and lots of people found that really valuable and easy to follow. And so if you haven't had the chance to take a look at that, take a look at that. We also do breathing exercises with people for stress reduction, and you should be able to find the breathing exercises sheet on wholelifemedicine.com. Or you can do things like exercise or yoga to reduce stress, actually using your physical body. In between the pressures of work and social life and home life, stress is really an inevitable aspect of life. And you have to find a natural outlet for reducing stress. And this is really recognized in the naturopathic and functional health community as really being an essential aspect of wellness. So, while conventional medicine has been the methodology of treatment for decades, it just might not be enough to address systemic conditions because chronic disease diagnosis has been on the rise. Many people are really looking for a different kind of medicine to treat conditions systematically. And functional medicine and naturopathic medicine have been referred to as the medical care of the future because it really takes conventional medicine to the next level by incorporating more holistic ideas and methods that actually work. And a great thing is that, patients of Resonance Wellness have access to all these components of functional and naturopathic medicine. So if we take a look kind of in review of the components of functional medicine considers the whole body. So both in the diagnosis stage and in the treatment stage. It's treating the root cause of an illness and not just the symptoms. It uses natural treatments with fewer adverse side effects. It can really combine a scientifically proven treatment with alternative medicine to produce an integrated medical solution. And we're happy to work with your conventional practitioners where they're amenable. It utilizes diagnostic tests that can identify things that are moving towards disease but are not yet diseased. And we can focus better on disease prevention and more adequately address a chronic condition, especially the underpinnings of a chronic condition. So when all is said and done, the bottom line is that this kind of medicine recognizes the need for a life in balance with connection and community and support, and a sense of empowerment as essential elements for achieving optimal health. I've seen more people reverse health conditions by taking a hold of the information that I'm giving them and making major lifestyle changes or making choices for themselves than I have for any single medication or supplement or, surgical intervention in 20 years. So that is the bottom line. So I hope this gives you a little bit better of a sense of functional medicine and it's just clears up a little bit of the confusion about the difference between functional medicine and naturopathic medicine. Like I said, functional medicine is really some of the underpinning components of naturopathic medicine, and certainly it plays a role in the underpinnings of our whole life medicine model. And so I'm hoping that if you haven't had the chance to explore whole life medicine resource website, that you'll do that. I know I'm covering a lot of information in a general way here. So if you have questions, shoot them over to us at info@resonance-wellness.com. You might just find it a little bit easier to let this information sink in, or maybe take a look at the resources on that website and ask questions when you've had a chance to percolate. Either way, I'm here to help provide you with some answers. So thanks again for allowing me to share this experience with you today, and I hope you're going to join me for our next webinar. We are going to do meal prep in September. Everybody's favorite. I get lots of questions about, oh my gosh, how am I going to incorporate a more healthy lifestyle? And we're working right now on just helping you to find different ways of meal prep, and it might even include some videos of me in my kitchen, which could be exciting because I might have to clean some stuff up. So I hope you have a wonderful evening. Thanks for joining me, and we will hopefully see you in September for our next feature webinar. Take care, guys, and we'll talk to you really soon.
Thanks for watching. I love to connect to my patient community to inform and inspire, and I hope you'll join us again in the near future. Don't forget to check out whole-life-medicine.com for more webinars and events.